friends, welcome back to my channel. This is Nurse NAVPREET. I hope you all are doing well. So as promised, I am back again with second part of nursing interview questions and answers. So again, this video is gonna be useful for all the freshly pass out nurses, all the nurses who are ready to jump into nursing field and ready to go for their first interview. So this video will prepare you all the knowledge and skills that you need to answer all those questions. So without wasting any time, let's just jump into my channel's intro and then into the topic. Alright, so the first question is, what are the main qualities the nurse can have? So this question, you should be looking into the qualities a nurse should possess in order to work in a healthcare field. So you should include that nurse should have good communication skills. Nurse should be helpful and kind. She should be patient focused. Her focus should be patient oriented. She should be a good listener. Leadership qualities, compassionate care skills means be empathetic, understanding the feeling of a resident, working in a team to improve people's life. So team player is the main quality as well. So if I have to answer this question, I would say a nurse should possess good communication skills, so she can easily communicate between the families and the doctor and the co-workers. She should be patient focused and be a good listener. On top of that, she should be a good team player and also have leadership qualities so that she can successfully lead a team. And last but not the least, she should be helpful, kind, and full of compassionate care skills. Next question is, how would you handle rude co-worker/physician? So if any co-worker or physician is rude, how are you gonna answer to this question? So your answer should involve that you need to act professionally. You need to know the reason why they are rude. Are they having a bad day? Is that their habit? Or they are not happy with the care that you are giving towards their patient? So the best way to deal this situation is to talk. Communication is the key. You need to share your thoughts and feelings related to the behavior towards you. You can say, I find your behavior disrespectful. If they are still rude, you can try to involve the upper management like your supervisor. So if I have to answer this question, I would say, if somebody is rude to me, I would act professionally. Firstly, I would try to know the reason why they are rude. The best way to know more is to talk. So I try to communicate my thoughts and feelings related to their behavior, why they are rude to me. I would say, I don't like your behavior. I find this disrespectful to me. If they continue with the same behavior, I would try to involve my supervisor. So this is the best way to answer this question, and definitely they're gonna like your answer that you are aware how to handle these kinds of situations in your work area. Question is, why should we hire you for this job? So I would like to say here, before going for a job interview, try to go through the job posting, try to read through the job duties and qualities they are looking into a nurse. And you can say, I am a good candidate because I possess all the qualities that you are looking into a nurse, because you will be incorporating what they are looking into your answer. And then you can talk about all the skills that you have, and you can also share your experience being a nurse. So if I have to answer this question, I would say, I have read through the job duties and skills and qualities that you are looking into a nurse, and I possess all those skills and qualities, like I am passionate about my job, I have interest in nursing, I love my work, I believe in teamwork, I am critical thinker, and I know how to prioritize my work. I am punctual and knowledgeable, and I am working as a charge nurse from more than a year. Next question is why you want to work for our organization. So in this question, you would be looking into preparing yourself before going for a job interview, and try to look into company's mission, goals, and values, what they are expecting from you as their staff member. You can talk about company's positive environment and workers being pleasant with the management. And you can talk about the growth opportunities they are offering to their staff. So if I have to answer this question, I would say I have looked into company's missions, goals, and values that you are expecting from a staff member, and they are pretty much matching with my goals and mission. I also like to care for the people. I am very much impressed with the company's positive environment, and the workers are pleasant with the management. That's what I am looking for, because the good management contributes towards a good resident cares, good patient care, and good care of their staff members as well, and the continuous growth opportunities that you offer towards your staff members. That's what attracts me the most. So next question is, explain if any fellow nurse or co-worker made you upset and what you did, how you handled. You can talk about nurse coming in late continuously to relieve you from your shift, so you have to work extra after your shift was over. Any co-worker or your PSW took longer break, so that resulted in another PSW break got compromised and resident care got compromised. And you can talk about what you did after that, how you handled it, like your skills, communication skills, right? If I have to answer this question, I would say, so I was working as a charge nurse on my floor, and there was an agency PSW, and he was supposed to go for 15-minute coffee break, but instead he took 30 minutes of coffee break. So this way, another PSW break got compromised, the resident care got compromised. So what I did to handle, I tried to talk to him, I tried to make him understand that he is not entitled to take more than 15-minute coffee break, and this was happening more than for a few days already. Talked to him, and I also gave him the minutes with each our job duties, that what he's supposed to do from the beginning of the shift till the end of the shift, and what times he's supposed to take the break. So next comes, how would you deal with a difficult or irritated patient? So try to understand the reason behind the observed behavior. You need to handle this kind of situation professionally. Don't get offensive. Don't take anything personally. Be a good listener and a problem solver. So if I have to answer this question, I would say I would try to understand the reason behind the behavior, why that difficult or irritating behavior is occurring. I would try to handle this kind of behavior in a professional manner. I will try to talk. I will not get offensive, and I will not take anything personally. I will be a good listener and try to be a problem solver. The question is, patient is complaining of pain but doesn't want to be touched. How are you gonna deal with this? So I will try to talk and start the conversation. If patient is not answering or responding, I would still try to assess the level of the pain using the pain scale, like the nonverbal pain scale or the facial method. Then after assessing the level of the pain, you need to give the pain meds. And if patient doesn't want to be touched, so what are the reasons? Patient can be hesitant or fearful. That I would try to reduce by talk. I try to build a relationship and will improve nurse-client relationship. So I would say, so if the patient is complaining of pain and if he doesn't want to be touched, so first of all, I would try to know why he doesn't want to be touched. He can be hesitant or fearful. I try to reduce that fear or hesitancy by talk. I try to build nurse-client relationship. If he still doesn't want to be talked, I would assess the pain level using the pain scale. Then I will administer pain meds. Then I can go again and assess the pain level again. If it is not reducing and patient behavior is not improving, I would try to involve the doctor. Next question is, your shift is over and replacement has not come yet. What would you do? Answer should involve that you cannot leave your workplace until your handover. You will still be responsible for the unit. You need to know the work ethics that duty does not end with the end of your shift. You need to wait for considerate time. If does not show up, then you can call the manager for replacement. If I have to answer this question, I would say even if my shift is over, I am still responsible for the unit. I cannot leave the workplace until I hand over. I know my work ethics that my duty doesn't end with the end of my shift. I will wait for considerate time. If my coworker doesn't show up, then I will call the on-call manager for the replacement. So if you answer this question this way, they know that you know your work ethics and they can hire you. Like you have that passion to stay with the patient that you can't leave and you know your responsibility. So the next question is, being a nurse, very busy and thankless job sometimes. What are your thoughts? So here you need to understand that they are talking about nursing being a busy and thankless job. So they are talking about the negative aspect. You need to convert that negative point to a positive point. You can say that it is a busy profession, but you like to care for patients. Always try to solve the patient problem, and after solving their issues, you makes your patient happy, and that is the reward for you. So if I have to answer this question, I would say yes, it is a fact that nursing is busy and it was a very demanding job, but I like to care for patient. I always try to solve patient problems and issues, and I am always a good listener. After managing their issues and controlling their pain, my patient gets happy, and that is the only reward for me. So next comes, being a charge nurse, you feel you need to execute discipline in your staff. How would you do that? So you can say, being a charge nurse, you will be calling for a huddle and you will go through the policies and protocols of your organization. You will read out to them, you will make them aware, and you can say this is what you expect from them and you want them to follow them. And then you can also counsel your members. This way you will try to execute that discipline in your staff. So if I have to answer this question, I would say, being a charge nurse, I will call for a huddle. I will read out all the organization policies and protocols. I will make my staff aware that these policies and protocols is expected from them and they need to follow these. So I will also counsel my staff members. So this way I would try to execute the discipline in my staff. So next comes the last question of this topic. So conflict is very common in nursing. How would you avoid it? So you need to talk about conflict. You need to talk about keys to resolve it. You can talk about strategies you can use to avoid it. So I would answer this question saying, conflict is a misunderstanding that can happen among anyone in nursing because it is a very busy profession. Conflict can happen with the co-workers like PSWs and with the fellow nurses. So the best way to resolve is the communication. And being a good listener and being a good communicator, I can easily resolve this while working as a nurse. I would always share my thoughts and issues with my co-workers, and I will always listen to their side as well. So this way I would try to avoid the conflict while working as a nurse in your organization. So friends, that was all regarding today's video, part 2 of nursing interview questions and answers. I hope you liked my video. So in the end, I would like to say, please don't forget to subscribe my channel and also leave me a comment that what kind of videos would you like to watch in future. So until then, you have a good day. Thank you.